All right, guys, it is 8/31/2020, RT210. We have just completed the RT210G medical gas therapy lesson, the unit exam. A few people passed, a few people didn't. Most of it was in the, I had some 80s, some 85s. And then I had some lower grades. So, I mean, it's being taught, you guys. You have to study. You have to go over the lectures. You have to do the reading. You have to. And especially now, it's just going to be more and more involved, right? Complicated. You got to be able to pull the old with the new. Okay? You cannot forget about the old. Still got to know what the electrolyte values are. Still need to know what the heart is doing, the chambers of the heart. Still need to know the area of gas exchange in the lungs. All those things matter. So a couple of times ago, you can see, I guess it was pulmonary A and P, you learned the segments of the lungs. Well, now you're going to have to know how to drain those segments in the CPT portion of this module. Okay, this is aerosol, humidity, and CPT, which is chest physiotherapy or chest percussion therapy. Okay. Sometimes when we have patients who get a lot of secretions, right, and they become hard or dry, or so many of it, they're loculated in and they can't get out, right? You can't cough them up. Sometimes we have to turn their body a certain way to drain that segment out, okay? But if you don't know where the segment is, you won't know how to drain it, all right? You won't know how to tell me to drain the superior segments of the left and right lower lobes of the lungs, right? You have to tell me, you have to put the patient prone, which is on their stomach, because the superior lobes are in posterior of the lungs in the lower lobes. So in order to drain them, you have to sit the patient on his stomach, which is prone, okay? So you're going to learn those different positions. So you have to know positional terms like supine, prone, Fowler's, right? On the side, lateral, distal, posterior, anterior, apical posterior, all those type of directional terms you have to know, okay? You have to continue to go back to each section and study for 5 or 10 minutes for each one. So we are in H now, 210H. So you'll study 210H tonight, but you need to go back and grab another one. Go back to A, go back to B, go back to C. You have to do that. This has to consume 90% of your time, okay, in order to be successful. Now, so we are starting aerosol and humidity. Again, we're going to find out ways to mobilize secretions. When we have those secretions that we can't just cough them up, there are some things we have to do in order to mobilize them. Whether we can moisten them up with aerosol or humidity, or we can drain the body to make them drain, or we can do actual percussion where we beat on the patient's chest or back in order to loosen those secretions and mobilize them, okay? You're going to learn the different techniques. You're going to learn the different modalities and devices that we use to move secretions, right? So let's get started. I'm going to share my screen with the lesson plan. The note-taking guide has already been sent out to you guys. It's in the announcement. It's in the actual module, and I emailed it. Okay, so there's no reason for you to say you did not get it, right? So it's good to have that as we go along. All right. Do what? I don't know, but that's your charger. All right. Objectives for today. The objectives for today. Student will be able to demonstrate proper setup of humidifiers with high and low devices. And that should be just still part of number one, really. Number two, the next one, given situations, discuss humidity deficit and prevention, right? Give indications for humidity. What are the reasons why we need to do humidity? What will be some reasons we need to do humidity? All right. Give or discuss the factors influencing the efficacy or the efficiency of humidifiers, right? What makes one humidifier better than the other? What are some factors that make the humidifier be more productive or less? Given the situation, calculate the relative humidity, which is RH. The RH is the relative humidity. Discuss problems of the humidity deficit. You're going to have to know what humidity deficit means. Discuss the hazards of humidity. Like everything else, too much humidity can be hazardous, right? Demonstrate bronchial hygiene methods. Bronchial hygiene is cleaning the lungs. We clean the lungs with a good strong cough. We can clean the lungs with bronchoscopy. We can clear the lungs with airway clearance devices and breathing exercises. All of those different things can get us to have better bronchial hygiene. Then we will discuss indications for the use of those and discuss sputum induction. That's when we make the patient cough up something and spit it in a cup. All right, we need a sputum sample. We'll need them to cough up some sputum and spit it in a cup so we can send it off to be tested. That sputum will be gram stained and tested to see what organism is in it. Only when we know what organism it is the way we can know how to treat it. Okay? All right. You're going to have to be able, as far as lab is concerned, you have to be able to correctly assemble the different humidifiers, test for the function, safely apply them, and troubleshoot the following humidifiers: the Passover humidifier, the bubble humidifier, the cascade humidifier, and the wick humidifier, right? You'll be able to demonstrate the use of these humidifiers using appropriate delivery devices. Number 3, correctly monitor for the following as appropriate: the oxygen concentration and the temperature. All those things are important, especially temperature. Temperature is very, very important as it pertains to the humidity. Okay? Student will be able to position the patient and apply chest physiotherapy, which is CPT, and that is when we actually beat on the patient with a special technique to help loosen those secretions out of the specific segment. Okay? So don't forget, go back over your segments so that you can memorize the segments of the lungs. You need to know those segments, because if I ask you to drain the apical posterior segment, you need to know where that is. You can't just, yes, we do that. Respiratory therapy. All right. Body alignment. Demonstrate how to properly position, and we're talking about some of those positions you'll need to know. Fowlers and semi-fowlers, supine, prone, laying on the side, Sims and Trendelenburg. Now your Fowlers is when you're sitting straight up. When somebody is sitting up, straight up, that's Fowlers. When you kind of recline back a little bit, that's semi-Fowlers. Supine will be on your back. Supine is when you're laying on your back. Prone is when you're laying on your stomach. I like to tell you that when you're on your stomach, you're prone to anything, right? Anybody can jump on you, do whatever. You're totally helpless when you're laying on your stomach, okay? So that's why they call it prone. Then side laying, either you're laying on your left side or your right side. Sims, most people sleep in the Sims position. That is when you have your knee cocked up when you're laying on your stomach, right? You sleep on your stomach with your knee cocked up, that's the Sims position. And then Trendelenburg is when your feet are higher than your head. So when the head of the bed is tilted all the way down, that's Trendelenburg. Reverse Trendelenburg will be the head is higher than the feet, okay? Those are the positions you will need to know, okay? So when you're doing your lab, you're gonna say, okay, how do I drain this specific segment? You'll say, I have to have the patient laying in this position or that position, okay? All right, let's get started. We'll start off with humidity. Humidity. Humidity is simply water in a gaseous state. Water in gaseous state, or also known as water vapor. Water vapor, also known as molecular water in a gas. So the molecular water in a gas, or the water vapor, is humidity. Humidity you cannot see. Aerosol you can see. Humidity you cannot see. This air that we're in this classroom is not 100% dry. It's going to have a humidity factor, especially being in the South when it's a high humidity level, right? You go outside in the South, not only is it hot in the summertime, but you can feel it sticking to you, right? You kind of feel thick. That's humidity. You can't see it, but you know it's there because as soon as you step out, you start sweating. That's the water in the air. Clammy feeling is hot. Yes, that's humid. That's humidity. Can't see it, but it is there, very much there. Now, when we talk about humidity, there's a couple of terms that we need to understand about humidity. The first term is potential humidity. The potential is the amount of water a gas can hold, okay? The amount of water that a gas can hold will be the potential humidity. Potential. If I said that everybody in here has the potential to hold $1 million, okay? Everybody in here has a potential to have $1 million. That will be your potential, okay? Now, the potential humidity, just keep that in mind, what I just said. The potential humidity is the amount of water vapor that a gas can hold, okay? It's determined by the temperature. So at any given temperature, a gas only has a certain potential of water it can hold, depending on the temperature, okay? The hotter it is, the more it can hold. Sometimes the potential is also referred to as capacity. The capacity of the gas is also known as potential. So potential humidity or capacity of the gas is the same thing. It's the amount of water vapor a gas can hold. That's its potential. Now, when the gas has reached its full potential, then it's considered to be saturated. It's saturated with water vapor. Okay? When a gas has reached its potential at a certain temperature, then it's considered to be saturated. So if I said the gas outside has the potential to hold 44 milligrams of water at body temperature, okay? At regular body temperature, gas has the ability or potential to hold 44 milligrams of water. Body temperature is what in Celsius? Normal body temperature in Celsius is got somebody in the chat. Let me see what the chat is saying. 37 degrees. I can't hear you. You gotta speak up. I tell you that all the time. 37 degrees Celsius and 98.6 Fahrenheit. That is normal body temperature. You must have that down pat. Okay? So if I said a gas has the potential to hold 44 milligrams of water at body temperature, that will be its potential. Okay? The potential is 44 milligrams of water. That's its potential. At that temperature, it has the potential to hold 44. So if a gas is actually holding that 44, then it's considered to be what? So y'all need to pay attention to me, okay? There's a lot of information that you're gonna miss. The potential humidity is the amount of water vapor a gas can hold at a certain temperature. And if I said a gas has the potential to hold 44 milligrams of water at 37 degrees Celsius, then that is its potential, okay? At 37 degrees Celsius, it has the potential to hold 40. That don't mean it's holding it, but it has the potential to hold 44 milligrams of water. So if you test that water or that gas and it is holding that 44, then that gas is considered to be it's reaching
Humid.
potential. What's the word? What's that word when it's reached its potential? What's the word?
Humid.
Not humid. No. When the gas has reached its potential, that's considered to be saturated. Saturated. Okay? So if it has the potential to hold 44 and it's holding 44, then it's saturated. If it has the potential to hold 20 and it's holding 20, then it's saturated. Okay? Because it only had the potential to hold 20, so it's holding 20, so it's saturated. Okay? It's holding 100% of what it can hold. All right? Now, the next term, absolute humidity. Absolute is the amount that is being held by that gas, okay? It's the what you got in parentheses. I always say what you got. Absolute is what you got, okay? So if you have the potential to hold 1,000,000, but you only have 100, then your absolute is 100. You got the potential to hold 1,000,000, but you don't have that yet. You only have 100. So your absolute, if I pull your money out your pocket, is what you got right now, right? Is your absolute. That's the absolute amount of money I have right now, is what's in my pocket. So if I pull it out your pocket, that is your absolute, okay? So when we're looking at the gas, it has a potential to hold something, but when you actually test it, what is it actually holding? Whatever it's actually holding is its absolute humidity, okay? So potential and absolute come together in a formula to determine what's called relative humidity. The relative humidity is the amount of absolute over potential humidity times 100. That gives us our percentage, okay? That gives us our percentage of gas or of humidity, right? Relative humidity, the RH. The RH is the relative humidity, which is the absolute humidity divided by the potential humidity times 100, okay? All right, so for example, if I say a gas has the ability to hold 44 milligrams of water at 37 degrees Celsius, that is its potential, okay? So its potential is 44 milligrams, okay? That's its potential. But then I actually go out there and test it. And when I test it, it's only holding 22 milligrams. So what is its relative humidity? How much? 50%. It's only doing half of what it's supposed to be, right? If it has the ability to hold 44, but it's only holding 22, then the relative humidity is 50%. It is only holding 50% of what it's supposed to be holding, okay? Or what it has the potential to hold. What if I said a gas has the potential of 100 milligrams of water and it's only holding 25 milligrams? 25%. So that's, yeah, you're doing the formula. Absolute over potential times 100. But what if I said it has the potential to hold 44 and it's holding 26? That's when you'll need to make sure you know how to do the formula. So if it has a potential to hold 44, but it's only holding 36, then what is the relative humidity? How much? 81%? Okay, 81%. Yeah, I said if it has a potential to hold 44, but it's only holding 36. So you do 36 divided by 44 times 100 gives you what? 81%. Okay, so the relative humidity will be 81%. There you go. All right, so that's very important. The absolute humidity is expressed in milligrams per liter. So milligrams, what we're saying, 44 milligrams. So this is a statement I need everybody to understand. This is the statement right here about your the gas inside your lungs, because that we're respiratory therapists. We're not meteorologists. I could care less about what's going on outside. We are talking about the gas inside the lungs. Okay, so the gas inside the lungs. This is a true statement. 37 degrees Celsius, the gas in the lungs has the potential to hold 44 milligrams per liter of water. It is holding, well, let me say this. Okay. Also, the absolute humidity is 44 milligrams per liter of water. Therefore, the gas in lungs has a relative humidity of 100%. All right? So the formula is relative humidity equals absolute, which is 44 milligrams, over potential, 44 milligrams. Divide that by one, each other, that gives you 1 times 100, which equals 100% in the lungs. So RH of lungs. So at 37 degrees Celsius, the air inside your lungs has the ability or potential to hold 44, and it's holding 44. So it's completely saturated, also known as 100% relative humidity. Now, who does the job of this? What part of your body puts this much liquid in the gas? What part of your body is responsible for humidifying the air to 44 milligrams? Not the lungs. It's got to be like that before it gets to the lungs. Think about your pulmonary anatomy. What part of the body is responsible for humidifying the dry gas? Let me look at my chat. Huh? I can't hear you. No. No. What part of your body is responsible for that? We said wonderful, wonderful part of your body that does that. Yes, Judith, it's the nose. Remember, we said the nose, the wonderful, wonderful nose. Job is to humidify and protect. It heats, humidifies, and protects. So as the air goes in right here through the nose, remember, what does it do? It circulates in the nasal concha. Remember, I said it goes through and it has to circulate, and it's touching the skin. So as it's touching the skin, it's warming up, and it's also humidifying it. So by the time it gets down to the lungs, it has been humidified to 44 milligrams of water. That's why the alveolar air equation, you have to subtract the water vapor pressure, right? Because you have water vapor in there as well as oxygen. So that's why we want to know, well, how much is just oxygen? To find out what's just oxygen, we have to subtract the water vapor, and we have to subtract the CO2. Okay? That's why in the alveolar air equation, it says P bar minus water pressure. All right? So 44 milligrams of water (44 milligrams of water equals 44 milligrams per liter of water of H2O equals how much pressure? How much pressure of water is in the lungs? No. How much pressure? This is amount, milligrams. How much pressure is in the lungs? When you do the alveolar equation, what's the water pressure? What is the water pressure? How much? The water pressure, when we do 760 minus what? 47. 47 millimeters of mercury. That's another true statement. 44 milligrams of water equals 47 millimeters of mercury. See, now you got to go back because we said the alveolar air equation says that the alveolar pressure of oxygen in the alveoli, you have to do FiO2 times the P bar, which is the barometric pressure, subtract the water vapor pressure, right? The water pressure. Well, we never knew how much water that was. We just knew it exerted a pressure of 47. That's what we learned. But now you know that that pressure comes from 44 milligrams of water. Because at body temperature, when we inhale gas, it warms it up to body temperature, right? So at 37 degrees, which is body temperature, gas has the ability or the potential to hold 44. And because of the nose, it does hold it. Because of the nose and the back of the throat, it does. It has humidified and heated that gas perfectly to 44 milligrams of water, okay? That 44 milligrams of water exerts a pressure of 47 millimeters of mercury. So that's where the 47 comes from, okay? It comes from that 44 milligrams of water. Now, since it has the potential to hold 44 and the nose takes care of that and makes sure that it does hold the whole 44, then we have a potential or absolute of 44 over the potential of 44, which is 100%. Okay, it's 100%. That's how you do relative humidity. All right, so that's relative humidity. It's expressed as a percentage. Relative humidity will be expressed as a percent, okay? So one last one. If you have a gas, if I said, I'm gonna do it on the board, I want you to tell me your answer. Example. Let's just say a gas at 85 degrees Fahrenheit has potential to hold 30 milligrams of water. Okay? Its absolute humidity is 15 milligrams of H2O. What is the RH? All right, before you yell at any answers, give people time to work them out. That's the question. A gas, any gas at, and I just made up these numbers, a gas at 85 degrees Fahrenheit has a potential to hold 30 milligrams of water. Its absolute humidity is 15 milligrams of water. What is the relative humidity? Give me a minute to work that out. All right, DeAsia, what you get? $200. Relative humidity, there's the formula right there. Absolute over potential times 100. Absolute over potential times 100. That's the formula.
So it'd be 30 over 15. Well, I mean,
Yes. Potential, well, potential has potential to hold 30. So 30 at the bottom. And its absolute is 15. So 15 at the top. So 15 divided by 30 times 100. $15 divided by 30. Take that answer times 100.
if you do 15.
15 divided by 30. 15 divided by 30 divided by 30 times 100. $15 divided by 30 gonna be 0.5. 15 divided by 30. What you get when you do 15 divided by 30?
I didn't do it. I just know it's
I know. Just do it. Just do 15 divided by 30 on her calculator because it shouldn't be the calculator. And she should have got 0.5. 15 divided by 30. So if that's doing something else, I'm throwing that one in the trash. 15 divided by 30. So it's not the calculator. 15 divided by 30 is 0.5, right? 0 times 100 is 50%. Okay, 50%. So the relative humidity is 50%. Okay? Has the potential to hold 30, but it's only holding 15.
But from that alone, then, I mean, like, you would have known the percentage to 30 and 15.
You would have known, yeah, unless I would have did a different number, though. I did it easy on purpose, but I could have said all kind of crazy number, right? I could have said it has potential to hold 210, but it's only holding 185. Then you need to know the formula to figure that out, okay? All right. That's how you find relative humidity, guys, okay? So what's important is body gas. The gas inside your body is 37 degrees Celsius, unless you have a what? What would be a reason why it ain't 37 degrees? What would be a basic reason, thinking too deep? A basic reason why your body wouldn't be 37 degrees? A fever, okay? A fever. So a higher temperature will affect the capacity of a gas, okay? Gas is capacity, which is potential, right? Potential capacity, same thing. The capacity to hold water vapor greatly dependent on the temperature, okay? If I drop that temperature, you don't have the same relative humidity, okay? You won't have the same relative humidity, all right? Now, if I drop the temperature, the potential going to go down and the absolute's going to go down. So the relative humidity will still be 100%, okay? But it's going to affect both the absolute and the potential, all right? Y'all see that? Show you that in a minute. All right. Moving right along. So this is what I just said, H already. Number H, alveolar gas. Alveolar gas is 100% relative humidity. Why? Because it has ability to hold 44 and it's holding 44. Therefore, it's completely saturated or a relative humidity of 100%. Okay? Got that, D? Okay. So at 37 degrees Celsius, alveolar gas holds approximately 44 milligrams of water. At 37 degrees Celsius and 100% relative humidity, the pressure that is exerted by that water is 47 millimeters of mercury. That's where you got the 47 millimeters of mercury from in the alveolar air equation. Okay, now we know where that pressure came from. We know the P bar, that's barometric pressure, right? That's just a natural barometric pressure at regular sea level, right? Today you took a test and it talked about 3 atmospheres. Okay, that was a tricky one there, okay, on your test. I asked you what was the pressure of oxygen at 3 atmospheres if the patient was on 2 liters per minute, right? So in order to find that, guys, you had to do this. I asked you what was the pressure of oxygen? What was the pressure of O2? I said the pressure of oxygen at 3 atmospheres. Okay? If the patient is breathing 2 liters per minute by nasal cannula. Okay? Well, we found out that at 1 atmosphere, what's the barometric pressure at 1 atmosphere? 760. So 1 atmos is 760. All right? And so the pressure of oxygen would be 760 times 0.21, right? So 21% in the atmosphere, which gave us 159 millimeters of mercury. But I said, what is the oxygen pressure at 3 atmos? So at 3 atmos, right? And he's breathing 2 liters per minute. So if a patient is on 2 liters, what do we say their FO2 is about? The rule of 4s. 2 liters is about what? You gotta have known that. The rule of 4s. 28%. So that would be 3 atmos times 0.28. 0.28. And that would give us the pressure of oxygen, right? Because 21 is room air, right? At 1 atmosphere is 760 times 0.21 is 159. So the pressure of oxygen in this room is 159 millimeters of mercury. But I told you the patient was in the hyperbaric chamber and it went down 3 atmospheres. So first of all, how much is 3 atmospheres? Don't guess. 3 atmospheres, 3 times 760. 3 times 760. 1 atmosphere is 760, so 3 atmospheres is what? All right, so 3 atmospheres is 2280 millimeters of mercury. 2280 times how much oxygen he on? 21. Not 21, he's on 2 liters. 0.28 gives us how much? 638. So the answer was 638 millimeters of mercury. That's the PO2 in hyperbaric. So you see how good it is to be in hyperbaric, right? If you're in the hyperbaric, look how much stronger the oxygen is at 3 atmospheres. So it can do much better. It can go farther into the body. It helps perfusion into those areas for reasons why we use hyperbaric therapy, okay? You have to read and have to study those things. That was in the last lesson. That's how we found that answer, okay? So that's why I put think of all the parts of this problem. You had to first think about the barometric pressure at 1 atmosphere. You know that's 760, so 3 atmospheres will be 2280, right? And if he's on 2 liters, he's not 21%, he's 28%. So that times 0.28 gave us our pressure of 638 millimeters of mercury. All right, this is real RT work, okay? All right, at this time, we're gonna take us a break. We're gonna take us a break, come back and talk about humidity deficit. So it's 2:50, come back at 3 o'clock. We're gonna come back at 3 o'clock and talk about humidity deficit, okay? And what can happen if you don't have humidity. It's a domino effect. You would think something as little as not having humidity wouldn't be that bad, but having no humidity in the airway can cause detrimental responses, okay? Stop the recording as we take a break. All right, let's get back started. We're going to finish up humidity. We're going to finish up humidity, and then I'm going to stop the lecture and give you an assignment for which is the discussion. Okay, the discussion will be open at 4 o'clock. So you can start the discussion. It's due by midnight. Not much. Probably a fun discussion anyways. It should be a nice little uplifting discussion. But we're going to finish that, and we'll start aerosol tomorrow. Okay, and I want to run into both of them in the same day. Aerosol, humidity. We're doing humidity right now. Finish up this. There's only like a slide or so left for humidity, and then we're going to stop. You can go and you can work on the discussion for tonight. The discussion is in the announcement, and discussion is also in the module. It tells you all the things that I'm looking for, your response and your initial post. Okay. All right. So here we are. Humidity deficit. The humidity deficit. Now, when we're dealing with humidity, we said that humidity outside in the ambient air is different than the humidity inside. Inside, we are 100% relative humidity, right? We are 100%. But say you are in Arizona, right? Somewhere in the desert. That's very hot, but it's very what? The air is very what? Dry, right? Very dry. Dry places like Arizona, California. It never rains in Southern California, that type of thing. Wildfires, because it's dry, right? It's very, very dry. And so the humidity in the outside air is way less than the humidity inside. So the body has to humidify that air even harder before it can use it. And it creates a deficit, okay? And that's what humidity deficit is. It's the amount of humidity in the alveolar gas minus the amount of humidity in inspired gas, okay? That's the humidity deficit. So if the humidity inside my lungs is 44 milligrams of water, but it's only 19 milligrams outside, what is the deficit? If the humidity inside my lungs is 44, right? It's 44 milligrams of water, right? But the humidity outside is only 19. 25, right? So the humidity deficit is 25 milligrams of water, right? That will be the deficit. The humidity deficit is simply the amount of humidity in my lungs minus the amount of humidity outside, okay? So it has to, depending on how dry it is outside, the more deficit you'll have, okay? If you're in Arizona or in the Sahara Desert in Africa or any other desert place, the humidity deficit will be great. And because of the deficit, it's going to take a toll on the body because it's having to humidify all this dry air, and it won't be able to keep up with it forever, okay? It's going to eventually dry you out if you're just out there like that, okay? You become very dehydrated, all right? Now, what is J? J says humidity supplied to inspired gas by the nasal pharyngeal and the oral pharyngeal passages, right? That is how we humidify the gas, through the nose and the oral pharyngeal. So in the nose and in the back of the throat, all of that is touching the gas, right? It's humidifying it and heating it up, okay? So that the alveoli can use it. It can't use it or doesn't want to use it if it's not right, right? We said that the true statement is the amount of humidity inside the lungs is 100% saturated because it has the potential to hold 44 at body temperature, and it's holding 44 at body temperature. So 44 divided by 44 is 1 times 100, with a relative humidity of 100%. The other word for relative humidity being 100% is saturated. Okay, so the gas inside your lungs is considered to be saturated. All right, now we know that the nose and the oral pharyngeal passages do this for us. But if not supplied by the nose, the moisture will be taken from the tracheal mucosa blanket. Remember we talked about the mucus blanket, right? The mucus blanket has the gel layer and the sol layer, and it lines all of the tracheobronchial tree. And as you breathe, those particles that make it past the nose and the nose hairs, right? Because you got a whole lot of hairs in your nose, right? Okay. I'm just playing. I won't see it. I'm just playing. The passages in your nose, if those particles get past that, then they get trapped on that mucus blanket, right? So the mucus blanket needs to be nice and moist so it can do its job, because there are cilia under that beat. And if they dry, they can't move, right? We said things that decrease the sol layer. I mean, the cilia movement. What are the 4 things we said that will alter the cilia? Smoking. No, it's the smoking, dehydration, which is what we're talking about right now, being dehydrated, a decrease in the sol layer, and one more. I forgot myself. Smoking, dehydration, decrease in sol layer. Yeah, so what we're talking, it's 4 of them, but I forgot the last one. But dehydration is what I'm talking about now, right? Not having that humidity will cause you to dehydrate. Now, we said smoking, yeah. And how does smoking paralyze it? Well, I just gave the answer. Smoking paralyzes the cilia, so that stops the movement, right? Dehydration will stop the movement because the mucus becomes thick and tenacious, right? Tenacious is a term, means like bubble gum, right? Thick like bubble gum, sticky, right? And so the cilia can't beat if it's real sticky and dry, okay? So that's very important. So now what's happening is if the nose is bypassed, so look at this patient right here, bless you. He now has a tracheostomy, okay? This patient has a tracheostomy, which is an artificial airway. So is the air going through his nose now? No, it's going straight through the tracheostomy, right? So now this is pure dry air going in right here and drying him out. It's going to dry him out unless we put him on a what? What do we put him on in a, yeah, what's that called? The whole thing called a aerosol. There you go. Aerosol trach mask or aerosol trach collar, okay? That's why we have to put the aerosol there, because those aerosol particles will continue to humidify him and keep him wet. If not, you're going to dry him out because the wonderful magical nose has been bypassed, okay? So an artificial airway bypasses the normal airway. Anytime your normal airway has been bypassed, either your mouth or your nose, if it's not in use anymore, then you have to humidify and heat the gas you give your patient. Otherwise, you're going to dry all of this out because out here is dry, right? It's dry in here. This dry fan, all of that is not being touched by the nose. It's not circulating in the concha or the oral or nasal pharyngeal. It's not touching the skin. It's not picking up anything. It's just dry, cold gas going through here, okay? And so, because he can't breathe through here if he has a trach. Well, if they have a trach out of their own, they have what's called an HME, which is a heat moisture exchanger. Remember HME, heat moisture exchanger. You'll see that a little later. No, it's something he has to put on there. If they're going to be out and about, they're going to have that on there. They do that to stop the air. So the air, because once you plug this off, if I plug this off, that air has to go out the mouth, up through the vocal cords and out the mouth, right? That's how they can talk. But if this is open, it's not going out the mouth. You can't talk. But when you push the button, now you can talk because the air is going the correct way. So when this is open, air is not going the correct way. So it's being bypassed. So anytime you have an artificial airway, which is a trach or ET tube, that tube that's down that young man's throat in the lab, That's an endotracheal tube. It's a long tube that goes in the mouth and goes all the way down just like this does. Instead of a trach, it starts at the mouth and goes down. Same place. You won't have both. You'll have either an ET tube or a tracheostomy. Okay, both of those are bypassing the nasal and the oral airway, because now, even though the tube is in his mouth, the air is inside the tube. It's not touching the nose, right? It's still being bypassed because it's going all the way down to the trach. All right? So,
When they do the trach, they gotta be on life support, right?
No, you don't have to be on life support. No. No, this depends. We do trachs at the bedside. We do trachs at the bedside. The physician will do the cutting, and we'll put them, and we'll do it right at the bedside. Now, we may have them on a little life support because we have them sedated, but we have to sedate you to cut you and do all of that. But as soon as you come around, we'll take you back off.
What would they put in for life support since that's going down the throat?
We would just plug a ventilator to it, attach a ventilator to it. You attach your ventilator, which is your life support, which is the ventilator.
So how fast do they got to put that in without poking it?
Well, it just depends. You know, it's a procedure. It's a procedure. You'll be right there with the doctor when he's doing it or when she's doing it. Okay? All right. So anytime, so what you need to know is and you'll get into more of that when 220 and 230 when you're talking about airways and vents and all of that. But anytime the airway or the nose, the natural airway is the nose and mouth. That's the way you breathe, right? Naturally. If that's bypassed, you must humidify and heat the gas. Otherwise, you're going to dry him out, okay? And so what it's telling you in the notes is telling you that without that, if it's not supplied by the nose, moisture will then be taken from the tracheal mucosal blanket, which will dry and thicken the secretions, right? You're not supposed to be humidified by the tracheal secretions, right? The trach is not supposed to be doing the job of the nose. The nose has a job. Now, the trach can help because it's moist, right? But the job of the nose is the job of the nose. And if the nose and mouth is bypassed, now the trachea got to heat it up because that gas has to be 44 before it gets to the lungs, okay? 44 milligrams of water before it gets to the lungs. So the trachea having to do that job for your nose because the nose has been bypassed, okay? And that's going to start causing a problem, right? The mucus blanket is going to start getting thick. It's going to start slowing down. See, it's a domino effect. It's going to be a domino effect. Now, look at K. Inadequate humidification can cause all of these things. Look at K. A decrease in cilia activity, right? Because you're making it dry. Cilia can't move because it's so dry. A decreased movement of mucus. Now, that mucus can't move up the escalator like it used to. So now all that trapped foreign particles are staying in, right? They're not getting out. They're staying in. So that can cause inflammation and death of the pulmonary epithelium, which can then cause a retention of secretions, right? Now you're not getting those secretions out. Those secretions that sit start to build what? Bacteria. Bacteria. Then that can ultimately close off small airways, which makes the alveoli close, which is atelectasis and ultimately pneumonia. So just not having the right amount of humidification can lead all the way down to dying from pneumonia. Okay? It's a domino effect. Humidity is very, very, very important. Okay? It's something that we take advantage of because we use our nose all day. Nose is doing it. Every breath that you have, your nose and mouth are doing that. Okay? That's why if you know somebody who sleeps with their mouth open, they wake up with their mouth really dry. Right? Because the nose is doing its job. The mouth is not really supposed to do it, right? So if you sleep with your mouth open, your mouth is dry, need some water because you've been sleeping, you've slept with your mouth open. You might not even know it, but if you wake up and your mouth is dry, that means you've been sleeping with your mouth open, okay? All right.
Okay, after they get it in, aren't they going to still try to breathe in through their mouth and nose?
You can't. When you take a breath, it's going to suck in through here. This is being blocked. This is now being blocked.
How do they feel like when that happens? Like
they're just gonna breathe. I mean, I'm sure it's uncomfortable, but they're gonna breathe. It's not gonna be nothing you got to think. Well, let me breathe through my trach and not my nose. It's just a natural reaction. Breathe. And when you breathe, it's gonna suck in through your. It's just like this. If you take a breath and I close your nose, it's gonna go through your what? mouth. You don't have to tell yourself, breathe through my mouth. It's just automatically going to go through your mouth because you're doing, as soon as you talk, taking a breath in and I close your mouth, it's going to go through your nose, just automatic. So if I close your mouth and your nose, it's going to go through the hole that's in the trach. Wherever it's got a hole, that's where it's going to come from. Okay? It's not going to be nothing you have to think about. We just cut them, slide it in, and stitch it to the skin until we can move the stitches a little later.
So will we have to stitch too?
No, the doctor will cut and stitch. We remove stitches when it's time to remove sutures. We take the trach out and put a smaller one in. We clean them, take care of everything. Everything is respiratory. Okay? All right. Now, indications for humidification. What are the reasons why we give humidification? Number one, to prevent dry gas from drying the mucosa. So to moisten dry gas, that's the first one, right? To moisten dry gas. And to provide near body temperature, to provide near body humidity when the upper airway function is impaired or bypassed. Because not only could be just bypassing because of breathing, but they could have had an accident and crushed their whole mouth and nose. It's all crushed, face crushed in. We have no way to give them air but to cut a hole in the trachea. Sometimes it happens on the scene. If somebody knows how to do it, they may heat a knife and cut the trachea. If their face has been crushed and the patient can't breathe, with cut right on the cricord card, they just put a straw or something in there so they can breathe till ambulance gets there. Hey, that's emergency medicine. It can happen, right? You see that in the movie sometimes. I mean, you what you want to do out in the field, man. You know. Not necessarily. If you are in your hospital uniform and you're doing some stuff that you ain't supposed to be doing, and they could use that, or if you're doing it at the hospital, then you ain't supposed to be doing that. You could probably get sued. But if you're just trying to help somebody, I mean, it just depends. You can get in trouble for pulling them out the car and say you should have left him in the car because now his back is broke or something like that. It's just you trying to help. You see the person gagging and trying to breathe, and you know you can't put an airway in because his face and teeth all crushed in. If you know that the next place is your tracheostomy, then you do what you have to do. Oh shoot, I forgot about the meeting. Yeah. It's posted. Yeah. So if it's an emergency, you have to do what you have to do. You just do it, right? You know you can cut that cricord and air start coming out of it. You stick a straw or something in there to let them breathe until the ambulance get there, okay? Or you just leave them alone and let them die. It's your choice.
So once you do that, do they have to keep that in, or once they say until they can get treated properly?
Yeah, they're gonna go to the hospital and they redo their trach, and they're gonna have to give them a trach if this is crushed up.
That's what I'm saying. Will they have to have a trach for the rest of their life?
Not maybe not. It just depends on if this can get healed enough to be back regular. It's a healing process. Some people have trachs for the rest of their life, and either from a trauma or just because their lungs can no longer do it by themselves. We have to have some kind of support, okay? Because if we take it out and you can't breathe, now we got to stick you through here again, right? We have to do a whole nother thing because the trachea is the fastest healing part of the body, the fastest. So if I take this trach right here out, the next day, the same trach won't go back in. It has healed that much in a couple of hours. It won't go back. I have to have a smaller one. If I don't have a smaller one on deck, I'm gonna have to go through the mouth, okay? And that's emergency because they ain't breathing, right? So you're supposed to have all this stuff at the bedside ready to go if something happens. Like I said, that'll be a little farther when you get down, all right? Now, so we said the indications for humidification will be to prevent dry gas from drying mucosa and to provide near body humidity when this is bypassed. So we know that the body's supposed to have 44 milligrams of water, right? That's the regular humidity for the body. So we have to try to give that with a machine, right? The aerosol face tint, aerosol trach color, aerosol T-piece. All of that aerosol is designed to give them the humidity that they would have had if their airway wasn't bypassed, okay? You got it? All right. So we have to do it. We do it with our high flow devices, okay? We also have some humidifiers that we use on some high flow devices. All right, we're going to get into those tomorrow and in the lab. Now, humidity adds moisture to the respiratory tract. I mean, that's just a basic thing. Yes, humidity will add moisture to the respiratory tract. That's why it's important to say you can do too much because you don't want to drown your patient, right? You don't want them to drown. So you have to not do too much, but you do have to have enough. So there's a, there's a range there that you're looking for, okay? Now, the last part for the day will be the clinical application. If a humidifier puts out a relative humidity of 100% at any given temperature, if they say, you use mine, I got a 5 humidifier now I made. You use mine, I'm gonna give a relative humidity of 100% no matter what's the temperature, right? That's what their selling point is, okay? Well, if you have one that does that and the temperature of the gas increases, then the relative humidity decreases, okay? The relative humidity would decrease. So if the temperature goes up, the relative humidity will decrease, okay? If the temperature goes up, because when the temperature, you holding something like the absolute doesn't change, but the potential changes, okay? Because the heat changes, so the potential changes, right? So look at this. If, let's say at 39 degrees Celsius, a gas has a potential of, let's say, has a potential of, let's just say 50 milligrams per liter, okay? I'm just giving some numbers here. These are just some numbers I'm making up, okay? At 37 degrees, let's just say a gas has a potential to hold 50 milligrams of water, right? And it's holding as an absolute of 50 milligrams per liter of water. So this makes the relative humidity what? 100%. Is that what you said? 100%. Well, if the temperature goes up till, let's say, 45 degrees Celsius, well, the potential now is 80 milligrams per liter, but the absolute is still 50. It's still holding 50 at that time. So what is the relative humidity now? 62%? 62%. So you see how the temperature went up, but the relative humidity went down. See that? See it? Okay. So that's what they're trying to say. If you got a machine that's giving a relative humidity of 100% and you up the temperature, well, the potential goes up, but that don't necessarily mean that the absolute went up. So the relative humidity goes down. Okay. Now look at this. If the temperature goes down, what if the temperature goes down? If the temperature of a gas that has a relative humidity of 100% decreases, then the relative humidity will stay the same, right? You're like, how? Because the potential and the actual both go down, okay? So look at this. Say you have that same 39 degrees Celsius, right? 39, you have a potential of 50, and it's holding 50, so it has a relative humidity of 100%, okay? But if the temperature goes down to 20 degrees Celsius, well, now the potential goes down to 25 milligrams, right? And the absolute will be 25 milligrams. So what's the relative humidity? 100%. Still has a relative humidity of 100%, but they both went down. So if the temperature goes down, the potential absolute both go down, but the relative humidity will still be 100%. Okay? If the temperature goes up, the potential goes up, but the absolute stays the same. That brings the relative humidity down. Okay? So that's what you need to remember. Make sure everybody can see that at home. I don't know if y'all can see me at the same time. So what we did here is the same 39 degrees Celsius has a potential of 50, absolute of 50, which is the relative humidity of 100%. But that temp went down to 20 degrees Celsius. Well, when the temperature goes down, relative humidity will still be 100% because the potential goes down and the absolute goes down. So 25 and 25 is still 100%. Okay. Now, the reason why they both go down, the potential goes down and the absolute goes down because it goes down to what's called rain out. Okay. If you have tube, look, everybody look at me. If you have gas flowing through a tube, okay? If you have gas flowing through this tube, right? Say at this end, it's 39 degrees, 37 degrees Celsius on this end, right? It's hot, right? Going through there, it's suspended with no problem. But by the time it gets to this end, it's down to 20 degrees Celsius. Now it's gotten colder, right? Well, as the temperature of the gas goes down, the gas particles get bigger and they start coalescing. They start coming together and they get heavier and heavier. No longer can fly. And they fall out. They fall out the sky. And that's water, right? Turns into water. If it cools down, as it cools down, it can no longer stay suspended. And it has to it turns into water droplets, like rain, right? So the clouds, when the clouds you see, when they're white, they're heated to hot enough, right, to be suspended. That's just gas vapor in the air. But when they get darker, those dark rain clouds, is because they're gotten colder. That cloud has met a cold front, right? And that the water particles inside the cloud became colder, and now they start to bloop, bloop, bloop together, and they get so heavy that they turn into rain, okay? That's what happens. So that's why when the temperature goes down, the potential goes down and the absolute gonna go down because it's not holding it anymore because it rained out. Okay, it can't hold it. It's too cold to hold, right? It can't hold it. So you got that water particle that's flying through the air, nice and warm, and then it hits a cold area, like you got the air conditioner blowing on your patient's tubing, right? Because coming from a machine and the humidifier and the heater is nice and perfect temp. But by the time it got to your patient, he got the fan on, the AC on in the room. So now the air around the tubing is super cold. So the gas inside drops down temperature. And when that happens, the water particles start coming together and it rains out. Same thing that happens in the clouds. Okay? It's called rain out. Okay? All right. So that's what that is right there. So look at the example. Humidifier puts out a gas that is 37 degrees Celsius and a relative humidity of 100%. The gas is delivered to the patient through a large bore tubing, right? That's this tubing. Anytime you have high flow, you're dealing with large bore tubing, right? As the gas travels through the tubing, it is cooled because the average room temperature is about 24 degrees Celsius. So this causes the delivered humidity to drop from 44 to about 22 and cause the water vapor to rain out and form condensation. That's why that's what we have in the middle of that circuit. Now, aerosol trait collar has large bore tubing, then what? We have the aerosol, our setup we did yesterday. We have the aerosol setup, right? The Venturi setup. Then we have one large bore tubing coming off of that. And then were y'all there for the lab? So what's right here? Before the next large bore tubing to the patient. What's in between the large bore tubing? What's in between the large bore tubings? The long tubing. What's that? The bag. Thank you. The bag. That's the drain bag because it's picking up what? Good, Judah. It's picking up the water that has rained out. So the aerosol stays floated, but as it gets colder, they turn into water droplets. So that's why we have a bag there. The bag, and we have the bag wherever the trough is of the line, then watch where we'll cut and put a bag. Because if it does rain out, gravity is gonna pull it to the trough, right? It's gonna pull it right here. If I put water in here, it's gonna sit right here in the trough, right? So that's where I was, okay, well, let me cut right here and put a bag in the middle. And so whenever it does rain out, it's going to collect in my bag. Okay? That's why how we decide how we're going to do our tubing, right? We put the tubing on the patient, we look and say, okay, well, especially a home patient, wherever their bed is to the actual machine and all of that, if I see that There's a trough right there. That's where I want to cut, because when you do home health, they're not going to give you the. You're going to have to. That's why you cut it on these sections here. Remember, I said that each section is 50 cc's. The smooth part you cut. We always, respiratory should always have some trauma shears, always. And then you can just take it right there in the middle, cut it, and put your stuff in between. Breathing treatment, whatever you need to do. When you buy these, or when they send them to the home patient, they're going to be one big long cord. You have to hook it to the machine and then go to the patient, cut off what you don't need, and then find out where the trough is, cut right there and put your bag in between. But that's where the water is, because you don't want that water to make its way to the patient's trach, right? If you ain't got a bag, if you don't have a bag and the water rains out and it runs into the trach, then they're going to drown. Then you got real pure water going straight into the airway. You don't want that, okay? All right. So that's what happens. It gets cooler, and as it gets cooler, it convalesces. Oh, I'm sorry. It condenses. It comes together and drops out. Okay, it's too heavy. Once they start combining with each other, they get too heavy to stay in the air, right? And as soon as they get too heavy, they just fall from the air as water droplets. That's called rain out. All right, I'm gonna stop right here. The next part is aerosol, which is different than humidity. They have some overlap and they have some things that are different. Some things are the same, some things that are different. All right, but the main difference is aerosol you can see, humidity you cannot see. Okay, we will continue with this part of the lecture on tomorrow. I'm going to stop the recording now, and you guys will, let me stop the share. Hold on. That is the end of today's lecture. We had test today and lecture. Go back over this. Make sure you do the reading that is assigned to this part, because it's a lot of valuable information. I need to see some 90s and 100s on this next test. All right? Now, for tonight at 4 o'clock, it's 3:30. At 4 o'clock, the discussion will open up. Okay, it will be available from 4 o'clock to midnight. You need to do your discussion tonight about humidity, what you've heard so far, what you've learned so far, and what you thought you knew about humidity, right? Put those things in there. The discussion will explain to you what I'm looking for, and I'll be looking at the word count. Make sure your first count is what it's supposed to be. I think it's 200 or 250 words, and then your responses need to be at least 50 words, okay? It does a word count, lets me know if you did enough words. All right, work on that tonight. I will see you guys tomorrow. Tutoring is tomorrow at 10. So if you like, you can join on tutoring tomorrow at 10. And we will get started and finish, well, not finish, but continue with the lecture at that time. All right, have a good day.